when we do labs, I think that it's really important that you measure what is available for use. You can order a lab that is a total T4 or a total T3. What that means is that that's the total measure of all the hormone, both available to be used and bound to a cell already, meaning it is no longer available to be used. You can kind of think about bound versus unbound, kind of like a seat in a theater. And so if somebody is sitting in a seat in a theater, that would be bound. And if you come along and you try to sit in that same seat, you're not going to be able to sit there, right? And so when we have bound hormone that is already bound to the cell, that means that we can't use that cell anymore. Just like if somebody's already sitting in your seat in the theater, you can't sit in that seat. So we really only want to know about the available seats, things that are available to be used in the body. And so when we measure that in the blood, we're looking at free T4 to understand what is available for use. Same thing with T3. If we're looking at total, then we get both all of the seats, whether they're occupied or not, and we don't really care about the occupied seats. We really only want to know what the available seats are. So we want to look, we get a more accurate view of what's going on with your thyroid if we look at free T3 as opposed to total T3. And I see all kinds of combinations of labs being ordered, and you do get some, I mean, it's some information, but it doesn't necessarily mean it's useful information.